Hi, everybody. Welcome back. My name is Elizabeth, and if you've joined me before, you know that I am one of the global travel nurses here at CNY Fertility. If you are joining us for the first time, thank you so much. I hope that you find value in what we have to discuss tonight. Tonight's topic is going to be a discussion of what it's like to use donor eggs here at CNY Fertility. We do have a donor team and of course our travel team, and sort of the differences in what our teams do can sometimes be a little bit confusing. Even for us, sometimes we look back and forth at each other like, who's best to handle this? But ultimately tonight I wanted to bring on to the live video here one of our nurses who is the donor team nurse. Her name is Allie, and she'll be joining us in just a minute. But she's going to help us learn a little bit more about what it entails to use donor eggs, what you might expect in terms of the different options, and then the different ways that our teams do work together to help you get from point A to point B. And so you might be thinking, what would be a good instance, or why might I use donor eggs? I've never heard of such a thing. And so donor eggs are a fantastic option for women who might find themselves with a less desirable egg reserve than might be conducive to a successful IVF outcome. Some of our clients who are older than 40 sometimes will find themselves in a position to use donor eggs, but people of all ages, for different reasons, require the use of donor eggs. And I always like to use the example of my sister who did use donor eggs, and as a result, I have my wonderful nephew. But it's just such a wonderful way that you can still bring home that dream of being a mother, even if for some reason we're not able to use your eggs. And so, like I said, in just a second, Allie will be joining us to talk a little bit more about that. And then towards the end, she and I will answer some questions together. So for any of you who have your burning questions, just stand by, and we will definitely get to those at the end. So let's see if Allie is ready to join us. Hi, Allie. How are you?
Hi, how are you?
Good. It's so
exciting.
Well, it's so nice to have you. I was just letting everybody know that you're going to help us kind of understand the nuances of using a donor egg if you're coming through our program, and just trying to help people understand kind of what the differences are in the different types of donor egg cycles. And then we can answer some questions towards the end. So if you're ready, why don't you just give us a little bit of an overview on the different options that exist for people who are wanting to use donor eggs?
All right, so we have 4 different package options. The first package option is the 6 fresh egg with a fresh embryo transfer. And what I mean by fresh embryo transfer is when we're actually preparing you, the recipient, for an embryo transfer while your donor is getting ready for her egg retrieval. So that's 6 fresh eggs with a fresh embryo transfer. The current cost is $12,000 plus your meds and monitoring. The second package option is the 6 fresh eggs to create and freeze embryos. So what we're doing with this package is we're actually cycling the donor first. We're creating your embryos, fertilizing the eggs retrieved from the donor with your partner or your donor sperm source. And then once you have embryos frozen, then you come back and you plan your frozen embryo transfer cycle. And so that is the 6 fresh eggs to create and freeze embryos. The current cost is $9,000. That's our most popular package option because the success rate between the fresh embryo transfer and frozen is so very similar that people appreciate that cost savings and create and freeze their embryos. The next package option is the 6 banked eggs. So CNY Fertility has its own egg bank. And so we have a list of donors that we can provide to you, and you can choose your eggs, whichever donor you like, and you receive those 6 banked eggs. And once you get your banked eggs, then you go on to plan your transfer cycle. Some people who travel from a long distance will actually choose to thaw those eggs ahead of time, fertilize them, and create and freeze embryos and then come back later and plan their frozen transfer cycle. And some want to prepare their lining for transfer and prepare for a fresh embryo transfer. So you have a couple of different options with that package. The people that are choosing the banked eggs are those that want to move forward pretty quickly. And so that's the great benefit about having those eggs already in the bank and ready to go. There's also those recipients that are not quite ready to give up using their own eggs. And so they still want to try their own IVF cycle, but because they know that they're very depleted and may or may not get an egg in that IVF cycle, we have this package of 4 banked eggs that we can add on to your IVF cycle, and we can thaw those on your egg retrieval day. So we'll thaw those eggs on egg retrieval day and fertilize those along with whatever is retrieved from your ovaries on that day from your own IVF cycle. And then you transfer 3 to 5 days later, and you and the doctor decide what is actually transferred. Some choose to transfer one of their own embryos and one from the donor. Some say, you know what, I like, the embryos I made this cycle are great. I'm going to hang on to the donor embryos for later on and freeze those. So you have some options, and that's something you'll discuss with the doctor.
And what happens to the extra embryos that you have? Are those still the clients to keep?
Any embryos that aren't transferred are then frozen for later use.
Awesome. Very cool. And is that the only options with donor eggs? Are people able to choose a donor of their own? Maybe from a family member or something of that nature?
I do have recipients that choose a friend or family member, and so they have the same kind of option. When you bring in your own donor, whether it is a friend or family member, you can choose to transfer fresh embryos from that cycle, meaning I'll prepare you for transfer while your donor is getting ready for egg retrieval, or you can choose to create and freeze. And most recipients, even in this situation, will choose to create and freeze embryos because it's a little bit easier for them. It's less stressful to just deal with one party at a time.
Absolutely. Yep. And we all know this process is so stressful. I tell my viewers every week that traveling for treatment certainly adds a level of complexity to the process. And so obviously involving donor eggs would certainly could add to that. We had a question from Shell that I thought maybe you could answer, Allie. Pardon me. There's the question. How much is the banked eggs that you add to your own? What would that look like?
So if you're doing an IVF cycle of your own and you're adding on the banked eggs, it's 4 for $4,000 in addition to the cost of your IVF cycle. You can also add on if you don't want to just purchase 4. If you want more, you can purchase additional eggs for $1,000 a piece.
Oh, that makes a lot of sense. Thank you so much. And just on to another question about cost. Heather was asking for the banked eggs, was the cost mentioned, or do patients maybe pay?
I forgot to mention it.
Yeah.
Yep. So the 6 banked egg package is $9,000. Additional eggs above and beyond that are $1,500 a piece with that package.
Okay, perfect. I hope that answers your question, Heather. Allie, can you help me understand maybe some things that, obviously our clients are many of them are going to meet with you first to establish a donor, either finding that donor in our banked package or fresh. But what are some things that our recipients often come back to you for, maybe after they have embryos, that you say to yourself, you know what, that's a great question. I feel like I'd like my travel team to answer that. What are some things that might fall under that category?
So once you have embryos or your banked eggs and you're moving on to go to do your frozen embryo transfer or your banked egg cycle, your next step would be to contact the travel team on day 1. I get an awful lot of messages with recipients that come back to me and let me know it's their day 1. So that's definitely something it's not that I don't want to take care of those recipients, because I totally can, but I feel like you guys, your team has your own way of keeping things organized. And so that's for consistency purposes. I like to send you back to the global travel team so that they can plan your whole cycle.
Yeah,
But
that makes a lot of sense.
things that I will, shall I go ahead and talk about the things I will do ahead of time?
Yeah, I would be good to know what they'll handle with you, and then what might be something that they might handle more with me. That'd be great.
Okay. So what happens is once you have your consultation and you know you're planning on using donor eggs, I'll get a message from that nurse practitioner or physician. Whoever did your consult will send me a message. You will then receive a message from the donor team in your patient portal giving you our package information, just some general information that we want you to review. And then that message also asks you to reach out to us, send us a message through your portal, letting us know when you can best be reached. And then over the phone, we talk to you about the financial aspect, about the matching process, your preconception testing that we require before you move forward, your consents, things like that. And so that's kind of where you start. And then from there, if you're going to choose fresh eggs in any sense, most of our donors have waiting lists. And so we do allow you to be added to up to 3 waiting lists at a time. So a lot of messages will be exchanged through the portal. You look through your patient portal where you'll be able to see your egg donor options, and you'll message the donor team with the donors you like. We will let you know how long each waiting list is and help you narrow your choices down. Once you get on your waiting lists, now it's just kind of a wait and hope for your message. And when a donor does become available to you, we then will send you a message with a text attached. So we don't ever send blind messages and expect you to just see that message in your portal. We'll send a text attached alerting you there's a message there. If the donor that we're offering you is the donor you want, we'll then work on creating your embryos. If you're creating and freezing your embryos, then you can expect those embryos 6 to 8 weeks later, because it takes some time. The process all takes time to cycle the donor. We're waiting for her to call with a period. We're putting her on the birth control pill, and then we're cycling her. And so in the meantime, while you're waiting for your embryos, you're going to work on your preconception labs for me. This is one thing I like to do before I send you to the global team, because they also have their IVF clients they're working with, right?
Yes,
so
absolutely.
I like to get all that preconception testing done. So things like your preconception labs, which are your Hep B, Hep C, HIV, syphilis screen, rubella, blood type and screen, and your uterine testing, like saline sono, dye test, or hysteroscopy. And, we decide what's best for you over the phone. We'll talk about your history and decide which test you should have. And then semen analysis, so important. We often forget how important the sperm is in this situation. In every situation. Yeah. So we need that semen analysis. If your partner has never had a semen analysis, or it's been over a year, it's very important to look at the sperm source and make sure the sperm is okay moving forward. I hate for any of you to travel from so far to come here and then find out that there's no sperm to fertilize your eggs. So very important to consider that.
Yeah, we talked about that a lot last week, just the importance of not leaving any of these areas up for chance. We're already, we are able to take a lot of factors, male factor and different things into consideration when we do IVF, but obviously we do need sperm. And so we certainly cannot emphasize enough the importance of making sure that your partner or your sperm source has had an adequate semen analysis, and that we have that on file, so that if we need to have any backup plans in place, we can do that. So I think it's important to note that the preconception testing that you might do for if you're going to have some type of donor cycle, it's the same testing that the travel team would ask you to do. So even if you're undecided, when you first meet with the provider, you talk to the provider on the phone. If you're undecided, maybe you might use donor eggs, you're not sure. Just know that all that testing is the same. And so we're not going to have you repeat any testing or do any testing that, isn't necessary for, whichever avenue you decide to take. And so I think that's important to note. Can you take me through, Allie, can you just take us through quickly, and then we'll answer some questions, because I know that's really top of people's mind. But actually, before we do, this is a great question we get asked. Allie, do you mind answering, do we have sperm donors? That's a question I get a fair amount.
You know what? We don't currently have sperm donors available. It's something that's always on Dr. Kiltz's mind, something he would love to do in the future, but right now we don't. But you can get your donor sperm very easily from any New York State approved sperm bank. And I always say, if you're doing IVF or donor eggs, purchase the cheapest preparation. You don't have to be too concerned about which preparation. Go with the cheapest. We need 1 vial per cycle. And I like to recommend that maybe you get a backup vial. You just never know. So if it's something that's possible, a backup vial is nice to have.
Absolutely. Never, especially like we said, with all of the expense, the travel time, and those things, having backups is always a good thing. Can you help us all understand a situation where someone's interested in donor eggs, but they don't know what package they want? They don't really know what to do next. How would you be able to help maybe narrow down their options?
As far as helping somebody choose a package option, my favorite, and I've also mentioned or already mentioned that it's our recipient's favorite, is that Fresh Egg Create and Freeze embryo package, because the success rate is so great. I always like to talk to my recipients about banked eggs and how those work, because banked eggs are the way of the world. People are choosing banked eggs. There's so many egg banks out there. There's so many choices. But with banked eggs, it's definitely a viable option and an affordable option. But you have to have reasonable expectations. And so when we freeze and thaw eggs, you have to remember it's 1 single cell. It's a very delicate process. So we can lose eggs in a freeze thaw. That's why I like that Fresh Egg Create and Freeze embryo package, because I'm thinking that it yields a larger quantity of embryos overall. And I'm one who likes to bank my options. I like to have embryos ready to go, backup plans. And so that's why I really like that Fresh Egg Create and Freeze package.
That makes a lot of sense. And there really are so many options that Allie and her team can help you with, that we really will try to help narrow down what might be best in your given situation. I'm seeing a lot of questions that people are asking, can you do gender selection if you use donor eggs? And the answer is absolutely. So what would somebody need to do if they wanted to do gender selection with their donor egg package?
First of all, if you are choosing gender selection, I do recommend fresh eggs. And I also recommend, on top of that 6 fresh eggs, that you purchase additional eggs. I like to see people that are planning on doing the PGT testing that includes our gender. I'd like to see them purchase at least 8 to 10 eggs, because you have to remember, statistically, whatever fertilizes, 50% of those embryos grow to blast. And so if you start with 6, let's say 4 out of those 6 embryos 6 eggs fertilize and become embryos. So then if 50% of those grow to blast, then you're starting with testing only 2 embryos. So maximize your chances, invest from the beginning, and hopefully you get what you're hoping for. And that's the other thing. If you're doing gender selection, you have to understand that it's all very random. The sperm decide the sex of your embryo. And we can't choose the male or female sperm. We choose the best sperm to inject into your eggs. And so we can never guarantee that you're going to get the gender you're hoping for. So increasing your egg numbers right from the beginning will improve your chances at getting that girl or boy.
Absolutely. That makes a lot of sense too. Shell was asking what the wait, you mentioned there was sometimes a waiting list. What is the waiting list like for the banked eggs?
So banked eggs are first come, first served. And so we don't keep a waiting list. We have an easy copy and paste. So I have lots of recipients that will ask for this list every day. As egg retrievals happen, that banked egg list changes. And so you could literally ask for us to send you that list every day. It does not bother us. But yes, we don't have a wait list for our banked eggs.
Perfect. And on that topic, what would you say if a client came to you for the first time today? She knows she wants to use donor eggs, and she says, "How long till I can get pregnant? How long till I can do my transfer?" What's the most common time frame we can give when someone is using donor?
It depends what package option. If you're choosing banked eggs, it really depends on which donors you like and how firm your criteria is. If you're somebody who has some very specific criteria, it's going to take you longer than somebody who has a very broad, I don't know.
Yeah, no, I say that all the time
criteria.
Yeah, you know, like absolutely. I tell clients that all the time.
Some people are not picky. Some people just want a baby and they will come in and choose any donor. And then there are people that have some specific criteria. It's a very personal choice. And so if you're somebody with very specific criteria, it may be difficult for you to find donors in the first place to even inquire about, or you may see 3 or 4. It will depend on how long. So banked eggs, no waiting list. Fresh eggs, there's going to be waiting lists, and they vary from donor to donor. We have our favorites, and then we have donors that kind of wait a little bit, and but there is somebody for everyone. And so it's really going to depend on which donors you like. And so it could be a matter of 6 weeks before you're matched with a donor. It could be several months. And I get this question so often, and it's really hard to put a time frame on it. Each fresh donor egg cycle takes 8 weeks. And so every 8 weeks, we go through our waiting lists, we revise them, we take out anybody who already has embryos or who has gotten pregnant and moved on, and then we start at the top and work our way down. And there will be a lot of recipients that decline. And so if you're, let's say, number 10 on the list, it is possible to get matched with that donor in her very next cycle. I've seen it happen.
Yep. So you definitely have to stay on top of it for sure. Another question that I wanted to look at was from Emily. She said, how about medicine protocol? Who decides that, the donor or the travel? And I can answer from my side, that's decided by the provider. So your medication protocol as the recipient and the, for Allie's donors would obviously be decided by the provider, but a provider is always going to help look at your unique situation and help to formulate a protocol that has your needs best in mind. So for all of our recipients, the provider is going to, and that could be if you are only using donor eggs, that protocol might be determined by the provider at your new patient consultation, versus if along your journey you discover that we may need to add donor eggs on, then that's something the provider would sort of help with during a follow-up call.
Yep. For our recipients, the provider, once he or she does your consultation, they usually map out your protocol right in their consult note. And so when I determine that your preconception testing is complete, then I will look back at that note and I will order the meds that the doctor or practitioner has suggested. And certainly, I want to encourage everybody to have conversations with us. If there's something they've seen out there that they were really hoping to try to include, we're always happy to look at that and talk to a provider and add medications if you were hoping for something other than what we've ordered for you.
Yeah, absolutely. And I saw a couple people asked, and now's a great time to ask questions. So those of you who have questions, feel free to drop them in the comments. But I've seen a couple questions in the thread tonight about, are you still a candidate? I'm guessing for donor eggs, if you've had your tubes tied. And this is a very good question. Allie, what's the answer?
Absolutely. We're bypassing the tubes with IVF. So the tubes are important for certain reasons. We want to make sure that there is no scar tissue in them or other issues that could affect implantation, but we're certainly not needing those tubes for this process. So absolutely.
Yep, 100% having a tubal ligation or your tubes tied would certainly not keep you from using donor eggs. Like Allie said, we're just bypassing them altogether. So great answer. Kayla looks like asked, and we talked about this a little bit earlier, but we will certainly be happy to answer it again. Does your husband need to have a sperm analysis done before your consultation? Before your consultation, not necessarily. So he could certainly have that done, and we will provide orders for him to have that done if needed once you have your new patient consultation. But Allie said it before, and I say it all the time, we cannot stress enough the importance of making sure you've got that semen analysis done prior to embarking on your treatment journey, just because there are so many unknowns that are often a result of the sperm that a lot of heartache can be avoided if we can get that taken care of in the beginning. So another question from Monica, she asks, and Allie, this is a great question for you. If you bring your own egg donor, is the cost the same as if you were doing your own IVF package?
So a known donor cycle currently is $6,850. Medications for that donor are additional. So you have to plan on $6,850 for the actual, and that includes the donor initial screening, which includes some genetic screening as well, and New York State required infectious disease testing. And so that's included in that package price. You have to consider the IVF cycle, the anesthesia, and it does include one transfer for the recipient, but donor meds are not included in that cost, so something to consider. And the donor meds are usually between $2,500 to $3,000.
And does the recipient have any role in getting those meds to the donor, or do you handle that entirely?
So I'll order the medications, and then the pharmacy will actually reach out to the recipient for payment.
Perfect. That sounds great. I thought you might like to see this. Emily says, thanks to you. She finally has her donor cycling, and she wanted to thank you for all of your help. So those stories are always really positive. We like to see those.
I know, I love it. Thanks, Emily, for your comment. That's awesome.
Yeah, no, great question. Heather had a question at the time of transfer. How long is the pregnancy? How far along is the pregnancy considered to be? Which is a great question. And you are, we like to use the phrase pregnant until proven otherwise. And so at transfer, you are technically either 2 weeks, 3 days if the embryo is a day 3 embryo, or 2 weeks, 5 days if the embryo is a day 5. And so, Heather, you're right. The other Heather, technically you're not. Well, technically you are pregnant because there is an embryo growing inside of you or attempting to grow. So, absolutely great question. This isn't really have to do with donor eggs, so to speak, but Monica was asking, sorry that it was your third time. I didn't see you ask before, but she said, she's
hard to keep up.
It is hard to keep up, but thank you so much for keeping the questions coming. So Monica's asking, do you recommend an ERA if you've had some failed cycles? Allie, you want to take that one?
So I think that an ERA can provide some very important information as to how your body is responding to the progesterone and how ready for transfer you are on day. We usually do that biopsy on the 6th day of progesterone. It's an expensive test. And so the thing is with that is it can be helpful, or in most cases, it just shows us that you are responsive to that progesterone. You're ready for transfer using our normal protocol. And so for people with several failed cycles, I think it can be helpful, but just know that it's a costly test and you have to be prepared for the financial aspect of that, and for potentially finding out information that really doesn't change our protocol in the future for you.
Yeah, absolutely. If I could just add to that, an ERA is indeed a fantastic test if, like Ali said, you have multiple failed cycles, but it only is truly valuable with regard to your window of implantation as it relates to progesterone, just like Ali said. And so if and window of implantation or receptivity to progesterone is just one of many factors that kind of have to be just right. And so, yes, can be very, very helpful. However, if your particular issue is not related to that window of implantation or receptivity for progesterone, then yes, you have paid for a costly test that maybe wouldn't necessarily give us any answers. So definitely a very good point. Another question that I had, I think this is such a great question. And Victoria, thank you so much for asking it. And I'll ask Ali to weigh in first, and then I kind of will. But the question is, what do you tell people who are trying to wrap their head around using a donor? And I can assume, Victoria, you're talking about maybe coming to terms with what that might be like for you. Ali, what are your thoughts?
You know, I have a lot of people that come to me with this issue. And so, you know, I think that it's all a grieving process, and you need to go through the motions. And for some people, those motions are trying 3 or 4 IVF cycles. For some people, their decisions are purely based on the financial aspect. Listen, if you don't have a very good ovarian reserve and you don't have a ton of money, and whatever money you are spending on your fertility treatment if that's limited, you may want to put your money where the doctor is saying your best chances are. And oftentimes that is using donor eggs. But again, it is a grieving process, and you have to go through those motions, and you have to be good and ready for it's a huge important decision.
Absolutely. And yeah, just adding to that, it's certainly something that, and for those of you who watch me, I feel like I might say this every week, but none of us, Ali, well, I can say for myself, have been through fertility treatment. None of us pictures that when we picture our future when we're little girls. We don't picture that. And we certainly don't picture what it might be like to use a donor egg where our baby might not look like us. And that is absolutely a grieving process, and one that you need to be gentle with yourself, and you need to take your time. Don't rush yourself or let anyone else rush you into that decision. But it is something where I can only share those positive stories from clients of mine from the past that have said that it was the best decision they ever made. I can think of a specific client right now, CNY client, who we had that heart to heart, and ultimately, you know, she's got her baby now. And she came back to me and she said, never is there a time I look at him and I don't see him as 100% mine. And I get chills telling that story because it's 100% true. And the same with my nephew, who was conceived from donor eggs. There's never a time I look at him and think of him as anything less than my nephew or anything different than my nephew. And I think they're all fair questions. But I think that just acknowledging them and working through that as a question is a really important thing. So thank you so much for that question. Miss Diaz asks, and this is a great question for Ali, if someone chooses to use donor eggs, is the donor information private? And what does that look like?
Is the identity private? So with our CNY anonymous egg donors, our program is anonymous. So we will never exchange information between donor and recipient. And so that is, for some people, they really want to have that open relationship. And for our anonymous donor program, unfortunately, we will never share information between donor and recipient.
And are there instances where, do we have any donors where they might be willing to, uncover their information when the child turns 18? Or is that just something that we don't do as a CNY donor program? Because I know some donor agencies offer that as an option. It looks like some questions were directed towards that.
So we don't offer it as an option, but we do talk to our donors about the future. And there is a donor sibling registry online, and there's several Facebook groups where donors go in and they join and find their recipients. So, and really, while I say our program is anonymous, there really isn't that much anonymity anymore with DNA testing nowadays. And so I feel like a lot of our donors in the future will be going towards DNA testing, and it's so common, and people are doing it. And so I see so many success stories in that sense. But for now, our program is going to remain anonymous.
That's a great question and a great answer. Let's take another question from Sabrina. Sorry, Sabrina. If someone has a low AMH, is there anything you can do to improve the quality of your eggs, supplements, etc.? And yes, there absolutely is. So we can only overcome the health of eggs if it's age-related concerns with eggs. There is truly only so much you can do. And those things would be looking at it. Again, it depends on what how old you are and what may be the underlying cause behind the low AMHs. But we offer a supplement called Ovarian Bloom that is a great option for improving the overall health of your eggs. Dr. Kiltz is a big proponent of using human growth hormone to improve quality. And then there are procedures that you could look at doing. Something very unique to CNY that we offer that most clinics do not is ovarian PRP or plasma, platelet-rich plasma infusions into the ovaries. And that, I like to kind of say it's like a stem cell treatment for your ovaries. And so that's an option in the cases of severely diminished ovarian reserve or low AMH. But overall, the supplement geared towards ovarian health would be most likely our Ovarian Bloom. There's other over-the-counter options like CoQ10, DHEA. I'm not telling you all to go get on those medications, but those are certainly something you can ask if that is something that would help you in specific. Allie, anything else to add in terms of improving quality?
Geez, I think you covered it all. You said the human growth hormone, estrogen priming. And so it's usually 30 to 60 days prior to your IVF cycle or your fertility treatment. And so it will be things like estrogen, human growth hormone, the DHEA, and the PRP infusion. What is Dr. Kiltz saying right now? Is it best 30 to 60 days or is it even 90 days ahead?
He's anywhere between 30 and 90, but given that the life cycle of the oocyte is, we're looking at it takes about 3 months to make a substantial improvement. Absolutely. If ovarian PRP is something that's been suggested for you, it's certainly the further out, the closer to that 90-day mark, the more benefit we're seeing from it. So absolutely.
Mm-hmm.
All right. It looks like a couple people are asking about the cost of ovarian PRP. I can't say for certain. I want to say it's around $1,500 if it's done with outside of an egg retrieval, or I want to say it's somewhere in the neighborhood of $600 or $800 if you do it with egg retrieval for benefit on a future egg retrieval. So if it's something you're going to be doing multiple retrievals, you certainly could do it with one retrieval with the goal that it benefits a future retrieval. So hopefully that helped. I always say don't ever quote me on prices here. If that's something you're really looking at, please contact our financial team. They're amazing, and they would be able to give you the most up-to-date information on that. So let's take one more question before we let Allie go, which is, do we provide a copy of medical or genetic history, family history, to kind of help guide somebody in terms of choosing a donor?
So when you're looking at our donors through your patient portal, you're going to see a 12-page history form. I believe you can print it on your end, but I know that we also save it to a PDF file and forward it to our recipients quite regularly. So yes, you'll have all that information. The genetic history may not be included in their profile. We can certainly send you a list of genetic tests that specific donor had.
That's great. Any last words of wisdom or thoughts that you'd like to share, just in terms of what the process is like using donor eggs when you're traveling? And so I just thought I would ask before I let you off the hook here.
It's a good question. And the one thing I do, back to the sperm that we didn't talk about, is a lot of people like to prepare ahead of time. One thing that'll keep your stress level low, if your partner is able to provide a sample and his semen analysis is pretty good, pretty close to normal, freezing the sperm ahead of time before that donor's cycle is a great option. It helps to avoid any last minute travel, keeps the stress level down. So something to really consider. Yeah, but I think we covered pretty much everything.
Yeah, no, on that topic, that's a great point. And on that topic, one thing that you will work with if you're the recipient of a donor egg, something that you'll work primarily with travel on is if you have those frozen eggs, is scheduling your oocyte thaw and your transfer. So the way that works is you would go through, just like once you work with Allie and her team and we have your frozen eggs, they're in your name, then you let the travel team know that you started your period. And then we sort of put you through an embryo transfer preparation in advance of that that thaw of the eggs. And so like Allie was saying, if you want to keep your stress level low, the more you can arrange ahead of time, the better. And that oftentimes comes down to the sperm, because the majority of our oocyte thaws and then subsequent transfers are typically day 3 transfers, not always, but that doesn't give you a ton of time in terms of heads up when your partner may need to be here to leave a sample. And so having that done ahead of time really makes the process a lot less stressful, because then you're looking at about 5 to 7 days advance before you would need to arrive for transfer, but you're not stressed with trying to get your partner to be here as well. So very, very good point. And we really cannot stress enough the importance of having your sperm here, on site ahead of schedule if possible. So, but Allie, thank you so much for joining me tonight. I know everybody, it seems like in terms of comments, people are really grateful for the information you were able to provide. And so hopefully we can do this again, maybe in 6 months or something, we can talk about donor again. But if you don't have anything else, thank you so much for joining us. I hope you have a great night. And again, we'll see you soon. Thank you, Allie. And everyone who is still with us, thank you so much for joining us tonight. If anybody has any last questions, we could answer those quickly. But otherwise, again, definitely continue to put information, put questions in the comments or topics that you'd like to see for future live streams. I will be doing a broadcast soon with a nurse who her sole job is to teach people how to use their fertility medications and walks people through that. So that's something that will be coming up in the next several weeks at some point. But I'm just really grateful that you all continue to join me. I hope to bring value to you every time that you join these live feeds. And like I said before, I think it's really important to recognize that the decision to use donor eggs is not an easy one, and not one that is going to be the same A to Z process for everyone. And so, like Allie mentioned, you might already know and be resolved that you are going to use donor eggs, or you might be somebody that's never considered it ever before. And we might be the first point that mentions it. And so again, not an easy decision, but please let us know how we are able to help. We do have a support coordinator who, if you need to kind of talk through those things, she might be a good option. You can always bring up donor eggs at any time if it's something that you're interested in. And then also just I always mention this, but the process of keeping your stress level down oftentimes comes up when it comes to just having all of the information. So even if you're not sure, you think you might need to use donor eggs, you've had a couple cycles that haven't gone as well as we had hoped, definitely look at, just reach out through the patient portal, send Allie a message, send any member of the donor team a message, and just ask for the information. Sometimes the decision to use donor eggs just starts with empowering yourself with all the information that you need. So a couple last questions. It looks like any vitamins I should take before using donor eggs. You should absolutely be taking prenatal vitamins if we have prescribed and you have low dose naltrexone or LDN that's been prescribed for you. That's another really good one to be taking now. And then just overall getting your mind and your body in the appropriate state for pregnancy. And so a lot of those things aren't necessarily medications or vitamins, but they're just about mindset and overall health. Do another talk on this soon, monthly. I will look at that. I don't know if Allie wants to deal with me monthly. No, I'm just kidding. But thank you. I'm glad that this was helpful. Brandy's asking, can someone decide to only trigger with HCG and skip Lupron? Brandy, that's a great question, one that we get quite a bit. And the decision of what to trigger with is primarily depending on what your estrogen levels are at your retrieval. And unfortunately, we don't know what that's going to be until the time comes, which is why we have everybody make sure that they have 2 doses of Lupron and 1 dose of HCG for trigger, so that we have all available options at our disposal when the time comes. And so you as the client always can decide what you'd like to use. So if you want to decline using a specific medication, that's certainly your prerogative to do so. But if we're suggesting a trigger with both HCG and Lupron, there is a reason for that. And so again, the short answer to your question is yes, always you are able to skip the Lupron if that's your choice. But in cases where we give you Lupron in your trigger instructions, again, there is a very specific reason for that. And some people do really well triggering with one or the other. But what we found, especially for our travel clients, is a little bit of both is usually the best, unless not indicated for a medical reason. A little bit of both helps to make sure that those eggs are mature when it comes time to do the retrieval, and that they are available for the retrieval. So up to what age can someone consider doing this? So Gertha, I think potentially your question is, do we have an age limit, or is there an age past which you would not be able to or eligible to use donor eggs? The answer is no. And in short, CNY Fertility was founded to offer fertility treatment to everyone at an affordable price. And part of that, and part of the vision and the passion of Dr. Kiltz is that we don't have those limits, because that's not our place. And so the answer to your question is you can make that decision as to what age might not be an age that you want to undergo the process. But for some of our clients who might be a little bit older, we might ask you to undergo medical clearance, things like that, just to make sure that your body's in a safe in a safe place for pregnancy. But ultimately, that decision is yours to make for yourself. So with that, I will leave it there. I hope everybody enjoyed this and enjoyed all of the great information that Allie had to offer. As always, if you have questions regarding your unique situation, definitely send us a message through the patient portal. You can give the office a call, obviously not now, but you can give the office a call and we're here to help. So everybody have a wonderful night, and I will be back next week. And if I don't have a topic picked yet, so if there's something that you have a burning desire to hear me talk about, definitely please put that in the comments so that I'm able to address that. Okay, everyone have a lovely week, and I will see you soon.